Hello. Hello, good evening.
Good evening, Yvonne.
Good evening.
Hello, everyone. Hello, good evening.
Good evening.
Good evening.
I'm sorry, I can see Yvonne logged off and she's the moderator, so I'll just start off. So today we'll be having our session 4 and reunite mother and child training cohort 2. And our topic, sexually transmitted infection. Our trainer today is Dr. Majala Mangombe, who is an obstetrician gynae with 10 years experience working in health sector in East Africa. She's passionate about reproductive health, especially endocrinology and infertility, which she has pursued her postgraduate diploma from the University of South Wales. She did a BHMC in the University of Nairobi, Masters in Medicine in Career University in Obstetrics and Gynecologist. She's currently working in Nairobi, private sector, and she's passionate about women health and mentors young girls and women both online and physically. So I am Katile Mutuku and I'm glad you joined all. So we'll start our session. Welcome so much, our speaker.
Thank you, Katile. Thank you so much, everyone. Good evening. I am honored to be part of this discussion today evening. I'm honored that I was asked to speak on STIs, a topic that, quite frankly, sometimes we do not discuss as much as we should. And as a result, is surrounded by a lot of stigma, a lot of inadequate knowledge, and a lot of long-term rather consequences that result because of this. So hopefully this can get the ball rolling and help us discuss some of the things that are facing the youth nowadays. So I'll start off. Sexually transmitted infections is what I'm going to discuss today. So I will briefly take us through STIs, because that's what sexually transmitted infections are in brief. I'll briefly take us through STIs. It's a very wide topic, so I'll try and discuss it in, say, 10, 15 minutes, just to give room for the participants to ask questions, and the discussion can roll from there. So when we think STIs, what are STIs? So STIs are infections that are transmitted from one person to another through sexual contact, and that's either vaginally, orally, or anally. However, some STIs can also be transmitted by skin-to-skin contact, and that's something sometimes we forget, particularly herpes and HPV. HPV being human papillomavirus, which is the one that causes cervical cancer. So this is very important for youth to know, that sometimes it doesn't have to be the actual act of sexual intercourse in terms of penetrative sex that transmits herpes and HPV. It's skin-to-skin contact as well. Another method of transmission that's important to note is what we call vertical transmission. So this is transmission from a pregnant mother to her unborn baby via the placenta when she's pregnant. So this is important, and this point speaks to why we do STI screening in pregnancy. This is very important because of the potential effects to the unborn baby. So why is it important for us to know about STIs? So like I said, one, there's a lot of stigma around it. And as a result of the stigma and the not talking about it, this results in a lot of long-term consequences being coming up later in either a woman's life or a man's life or a couple's life. Most times STIs are asymptomatic, meaning they do not present with symptoms. And most patients we have seen present to us when they already have the long-term complications. So like infertility, chronic pelvic pain, patients present this late when we could have done something to prevent if we had discussions like this, if we encouraged the youth to do their regular STI screenings, and if we discussed prevention of STIs from the get-go. So that's why it's very important. Like I said, aside from the long-term health consequences, there are also long-term social consequences. This is seen a lot, again, due to the stigma and the things that are associated with STIs, such as infertility, such as chronic pelvic pain. A lot of these young ladies or couples, basically, are faced with a lot of the psychological trauma. They're unable to deal with the STI diagnosis that they've been given. Let's say if it's HIV, they are not counseled well. And as a result, there's a lot of shame involved, a lot of shame and shunning from other family members. Also, we have noted cases, and I'm sure we've all seen or heard of cases where there is an increase in gender-based violence as a result of STIs. So because of all of these, it's important for us to have discussions like this and others. So the types of STIs can either be bacterial. We've heard of chlamydia, gonorrhea, syphilis, viral, such as HIV, herpes, genital warts, which is caused by HPV, like I said earlier, human papillomavirus, hepatitis B. There are also parasitic causes, such as Trichomonas vaginalis, and other STIs as well. So there are many, many STIs, but these are the common ones. There are certain risk factors that put us as youth at increased risk of acquisition of STIs. So one is if your first sexual encounter is at an early age, particularly in early adolescence, that has been associated with an increased risk. Multiple sexual partners for either you or if your partner has multiple sexual partners. presence of new partners. So if you move from one relationship into another, it's very important. I always counsel my patients to have a Sti screening done as you get into a relationship, and then also regularly screen for STIs. And again, it's important to be very open and honest with our patients, because like I said, there's a lot of stigma. So we've noted cases where when this is suggested to a lady or to her partner, it raises a lot of questions, and generally people start wondering whether they doubt the partner, but that's not really the case. What we are trying to encourage here is prevention through early screening and regular screening. Another risk factor is lack of or inconsistent condom use. Alcohol and drug use has also been associated with multiple partners, lack of condom use, and as a result, STI acquisition. Douching, this is something that we cannot discuss enough of, both rectal douching and vaginal douching. So what this does is it interferes with a normal environment in those mucosas, so in the vagina and in the rectum, for those who are practicing penetrative anal sex. So as a result of that, it puts the recipient at an increased risk of acquiring STIs. So this is something that, again, needs to be frequently discussed with the youth, because we have noted, a common practice. So another practice that's particularly common are other intravaginal practices, such as the most recent use of yoni pearls and vaginal steaming, and I think some people also call them vajacials. These have names that sound exciting, but the effect to your body can be detrimental, if I can use a very strong word. They interfere, like I said, with the normal environment, and as a result, put the patient or the lady at risk of acquiring STIs, acquiring other vaginal infections like bacterial vaginosis, which is not an STI, but increases one's risk of acquiring an STI. And then there are no current studies that have been done that show that vaginal steaming or use of yoni pearls treats the diseases that they are supposed to. They are supposed to treat, let's say fibroids or endometriosis. So let's say if you have a gynecological condition, if you have a discharge, if you have fibroids, if you have heavy menstrual bleeding, go to your gynecologist, have had or him diagnose your condition, and put you on an appropriate course of treatment, as opposed to trying things that in the long term may give you long-term effects. So like in terms of symptoms, I said most STIs are asymptomatic, and that is why screening is very important. However, the symptoms that we should look out for that should prompt us to seek treatment are presence of a vaginal discharge for women, presence of pain during sex, vaginal itchiness, pain when we urinate, pelvic pain, genital sores, and warts as well. For a man, generally the same symptoms: pain on urination, presence of a urethral discharge, and genital sores. So vaginal discharge most times will point towards causes like chlamydia, gonorrhea, trichomonas, and other vaginal infections such as candidiasis and bacterial vaginosis, which are not generally termed as STIs. Candidiasis, which is commonly called yeast infection or thrush, is a fungal infection. It can be transmitted vaginally, but is not generally termed an STI because there are other factors that cause it. For example, we've seen candidiasis occurring in pregnancy. It's caused generally by a change in the normal environment of our vagina. If a patient, when a patient presents with genital sores or ulcers, these are likely causes are herpes and syphilis. However, there are other causes of genital ulcers, and that's why it's important when you find something that you're not sure of to call your gynecologist or go to the hospital, have him or her examine and make an appropriate diagnosis and put you on treatment. Then in terms of screening and prevention, what can we do to prevent STIs? So the most efficient method of prevention, as much as we hear it, we say it all the time, we've always had the number one way to prevent STIs is abstinence. Yes. So I always say that's number one. And that's what I talk to young girls and young boys about. Number one is abstinence. Lowever, if you're sexually active, use a condom, particularly if you're not in a, either long-term relationship, then ensure you're using a condom. That's number one way of preventing STIs. Number three, also immunization. So nowadays we know we have immunization against HPV, human papillomavirus, which is the virus that causes, can cause cervical cancer. There are a number of vaccines that are out there. We vaccinate generally age groups between ages 9 and 13 years. However, why? That's because these age groups, vaccinating at these age groups results in a maximal benefit in terms of prevention of cervical cancer. Just generally vaccinating before one is sexually active. However, patients who are above, or young ladies and boys who are above 9 to 26 years, above 13 years of age to 26 years can be vaccinated. It's not recommended to people who are above 26 years of age. However, they can still get the benefit of vaccination. The reason that we don't recommend vaccination in people above 26 years of age is they possibly have already acquired HPV. So in terms of the benefit of vaccination, the benefit is minimal compared to if you vaccinate when the person is younger. But studies have shown that there still is a reduced risk of cervical cancer, and there still is a reduced risk of genital warts. So I always say, see your gynecologist, have them do a Pap smear and plus HPV testing, and then discuss vaccination. Another vaccine that's important to get is hepatitis B vaccine, yes. Then as regards regular screening, I always discuss with my clients about Pap smear screening. So this should be done from the age of, nowadays, current guidelines are from the age of 25 to 64 years of age. And generally Pap smears are done every 3 years. However, if your gynecologist does a Pap smear plus what we call a HPV test, which is what's called co-testing, then it increases your gap between one test and another to 5 years. However, important to note is in HIV positive patients, Pap smear cervical cancer screening should be done every year, unless otherwise stated, but most times done every year because of the increased risk of cervical cancer in these patients. It's also important to note that you should have regular other STI screening as well. So regular screening for chlamydia, the STIs I mentioned, chlamydia, gonorrhea, herpes, hepatitis B, trichomonas. And this screening should be done generally yearly if you're sexually active, with HIV being repeated 3 months after the first test. And as regards long-term effects, this just points towards, again, what I was discussing as to why STI screening is very important. Some of the long-term health effects that we see, number one is pelvic inflammatory disease. So this is whereby the infection spreads up. The infection spreads up the vagina, up into the uterus for the woman, into the tubes, and to her ovaries. So as a result, she gets chronic pelvic pain, either pain associated with her menses or not. And PID is usually very difficult to treat, particularly the recurrent pelvic pain that patients get. Another long-term consequence is infertility. This is as a result of PID. Again, like I said, spread to the fallopian tubes and to the ovaries. This in the tubes results in blockage of the tubes. So these are some long-term consequences that can be prevented if we focus on early screening, regular screening, and other preventative methods. Ectopic pregnancy is another long-term effect that can occur as a result of the infection spreading to the tube. Cervical cancer, like I said, human papillomavirus increases is a cause of cervical cancer. Infections to the newborn, like I mentioned, vertical transmission, and that's why STI screening is done regularly in pregnancy. And other psychological, social, and economic consequences that we discussed. Okay, so I'd like to stop there to allow us to take questions. Hi, Katile. Okay, I can see a few questions on the group. I can see one question on the group. I think it has already been answered. Okay, I can see. Okay, I can see another question on the group. I can see someone try to raise their hand. If the co-host can let her in or if she can unmute. Hi, Teresa.
Okay, hello.
Hi, how are you?
I'm fine, thank you. My question is, how accessible or how available are the STI screening services?
Okay, all right,
Yeah.
thanks for that. That's usually so in terms of availability, the tests are available. In terms of cost, sometimes the tests can be a bit costly, but hospitals, private hospitals tend to have packages where they reduce the cost to the patient and create a package of the commonly required STI screening, STIs that you need to screen. Generally, all of them, but private hospitals tend to have a package. Aside from private hospitals, facilities like Maristops also do regular STI screening, LCVT, health centers, government hospitals also do STI screening. So the issue most times is not just availability, but also not just availability, but also having the conversation, because a lot of times people shy away from having the conversation with their healthcare workers or discussing this in open. So I always say, at least get to a hospital, see your gynecologist, and he or she will guide you through the STIs that you need to screen for. Okay, someone is asking on the group, on the chat, what are the signs of PID? Yeah, so like we said earlier, PID is pelvic inflammatory disease. And the most common signs are pelvic pain, chronic pelvic pain, a vaginal discharge sometimes, fever sometimes, and vaginal itchiness, generally vaginal symptoms. So if you have these symptoms, again, see your gynecologist. He or she will examine you, rule out other causes, carry out other investigations such as vaginal swabs, certain blood tests, and come up with a diagnosis for PID and put you on treatment. Someone has asked another question: which strains of HPV can lead to cervical cancer? So generally, the high-risk strains of HPV lead to cervical cancer, so mainly 16 and 18. The low-risk types, what we call low-risk HPV type 6 and 11, are associated with genital warts. Yes, and the vaccines, the HPV vaccines, tend to target these high-risk groups. There are 3 types of HPV vaccines. Cervarix, Gardasil has two types, one that covers 9, one that's a nanovalent, and another one that covers 4. But generally, all the 3 vaccines cover for the 2 high risk 16 and 18 HPV. Is another question, can change of hormones cause an infection? So thanks for this question. So like I'd said earlier, hormonal infections such as candidiasis, which is yeast, which is also known as vaginal thrush, can result as a result of a hormonal imbalance of sorts. This results in a change in the normal environment of the vagina, and then a woman gets vaginal candidiasis. Do we have any questions? Anyone else?
Okay, I have a question.
Yes, Terry. Sorry,
Yeah,
Teresa.
so it's okay. So where does the difference between STIs and STDs come in?
Okay, so nowadays we refer to them as STIs, meaning infections, because there's a time they were illnesses, and then like you rightly said, diseases. So nowadays the new term is sexually transmitted infections. Why we got rid of the other term, diseases, is like I said at the beginning, a lot of times STIs are asymptomatic, meaning a patient has no symptoms. So a patient may, just to stress the fact that it's an infection and not just necessarily a disease process. Hi, Katile. Okay, so I think if there are no more questions, Katile, are you able to take over? Yes, yes.
Okay,
Yes.
so in the event where we maybe come across a teenager or an adolescent who has an STI,
Yes.
like we consider this person an underage person. So when they come for services in the hospital setup, like how do you go about ensuring this person gets the best services and the information that they need for them to be treated of their STIs?
Okay, yeah, so that's important. So like you rightly said, supposing you get an underage patient. So number one is, I'll say counseling, number one, and that helps in addressing the psychological part of STI. So counseling is very important. So in the healthcare system, we don't work on our own as gynecologists. We will have counselors who work with us in the hospital. So we would refer our patients to the counselors to take them through, since they're sexually active, what that means, what the risks are, how to protect themselves because they already are sexually active. So how to protect themselves going forward, and then carry them through testing. So discuss entire STI screening and then do regular follow-ups and checkups with these patients. essentially after 3 months to see how they are doing, but then that also depends on whether they have symptoms. So if the patient comes in with symptoms, you'd want to see them a few weeks later or a month later to see how they are doing, particularly an underage, an underage patient. I hope that answers your question, Teresa.
Yes, it does. Thank you.
All right, thanks. Katile? Anyone on the team?
Sorry, Dr. Can you hear me?
Yes, I can.
Sorry, I joined late, but that was a nice presentation. I just want this like a comment or an overview of like nowadays, as far as the category of STIs, are you still getting cases of syphilis? And if that happened in your setup, what is the latest in terms of diagnosis and treatment regime involved in such a case if you get a candidate with the syphilis? And then number two, for women in HPV, papilloma virus, how effective is the vaccine? And maybe you can, if I missed it, how long does the vaccine cover? Is it a lifelong coverage, or at a certain point you need to go for a booster dose, or how does the vaccine coverage happen?
Okay, so for HPV, thanks for that question. So for HPV, current studies have now shown that the 2-dose schedule is as effective as the 3-dose schedule, particularly, and like I said, for maximal benefit, vaccination should be given as early as possible. So before they're sexually active, between ages 9 to 13 for maximal benefit. And then, so yes, there are 3-dose schedules, but 2-dose schedule is as effective and 6 to 12 months apart, depending on the vaccine that's being given. And then, yes, we do get cases of syphilis. A lot of times we get patients who present with genital sores that can either be syphilitic ulcers or hepatic or herpes ulcers. There are instances where if testing is limited, we do what we call syndromic treatment, where treatment covers both whether it's herpes or syphilis. So where the patient is covered by with both an antibacterial and an antiviral. So syndromic treatment, I know particularly in government hospitals, occurs a lot when you're unable to particularly pinpoint the exact diagnosis.
Okay, that's good. But now, again, in the area of fertility, is there a possibility that, or is there any publication outside there which look at the issue of STI, especially when untreated for long, as far as its correlationship with infertility, either in male or in female? And if that is there, perhaps there is a paper on the same, is there a reverse process? Like, for example, you know, the culture of denial. You are suffering in silence. If you're a lady or a woman, you know you are smelling, but you manage with perfume, whatever you want, really, and your genitalia is kind of being damaged. And perhaps can be a consequences in terms of the fertility. So let's say I come Dr. Mwangombe, I now open up, this thing is too much on me. Is there a possibility of reversing the process, or how is the journey look like for such kind of a patient?
Okay, so then in terms of infertility, I had discussed earlier, the main causes usually is related to pelvic inflammatory disease, or what that can result in tubal blockage. So in terms of reversal, you can't quite reverse the disease process, but you can manage what you have at the moment. So when a patient comes, let's say a couple comes and they're struggling to conceive. So first things first, an entire history, and then investigation of the couple as is. So in tests for the man and tests for the woman. So now then tests for the woman also involve tests to assess and see if the tubes are open. So depending on the extent of tubal blockage, depending on whether it's one or both tubes that are blocked, and then now we can discuss and see what to do in terms of opening the tube. So surgery to open the tubes to increase her chances of conceiving. Again, if both tubes are blocked, the chances of success are usually slim. But yes, we do see cases where still with both tubes being blocked, we're able to open the tubes and then even offer additional treatments or additional fertility treatments for the patient or the couple.
What about for the man, for the male partner? At least for the ladies, at least yes, but what about for the male partner who is affected with the same?
Yes. What do you mean, what about for the male partner? Just
Let's say he's suffering from a serious STI. It comes to your clinic at a later stage, and perhaps you are even wondering, where have you been? Have you been with all this pain? Have you managing the pain? And then perhaps you get examination of the genitalia and you find maybe perhaps the damage is too much. Could that also be a root cause of infertility, or so far there is no paper looking at STI in male as far as infertility is concerned? Either we are looking at the DNA, the spermatozoa DNA damage, or we are looking at something which can contribute to the area of infertility. I don't know. I'm just trying to figure out, because for ladies, it's well pronounced that sometimes untreated, long untreated, the way you have put it, it can actually result into infertility. But nowadays we accept that it's no longer a lady's problem. Even male, a man contributes to the in the cause of infertility.
Yes. So even so that's why I said when the couple comes, we test both of them. So for the man, we'll do a seminalysis, and sometimes STIs are associated with either a low sperm count or reduced motility due to chronic infections. So depending on what we find on the seminalysis, and then now we can discuss other fertility treatments that may be able to help the couple. So yes, there is an effect on the sperm count and motility. Another question. Okay, I can see one. Why do these infections reoccur? Yes, so a lot of times, these infections are hard to treat. So that's why we focus on regular screening. STIs and the sequelae like PID are hard to treat. And then sometimes the practices that we do as women sometimes perpetuate or increase our risk of acquiring vaginal infections. So the question was for vaginal infections generally. So like I pointed out earlier, intravaginal practices like douching, vaginal steaming, using of perfumes, like someone mentioned earlier, vaginally, or lotions or soaps vaginally, all these just mess up the normal environment of the vagina. So we always say the vagina is self-cleansing. It cleans itself. It doesn't need you to add anything to scrub it or get rid of any odor. A lot of times all this does is helps perpetuate or cause recurrence of infections. So if you have a vaginal discharge or an odor you're unsure about, just see your doctor and have them properly investigate you and treat you. Okay, another follow-up question to that is, so how should the vagina be cleaned? Like I said, with water. So the vagina cleans itself. So when you're showering, okay, there's another question, hold on, Teresa. So when you're showering, just wash just with water, just pat your labia, wash down, up and down with water only. No soap, no lotions. Yes, Teresa?
Okay, so you talked about, what's it called? Vaginal and rectal douching. So does it mean that pubic hair contributes to keeping the normal environment of the vagina? So when we actually, no, when we women actually do vajacials, does it mean when we interfere or when we actually do the removal of the pubic hair, does it mean it affects the flora of the vagina? Like, my question is, does pubic hair have, like, what are the benefits of having pubic hair? Because it's like you're trying to say vajacial actually contributes to or is a risk factor to actually getting STIs.
Okay, so vajacial.
Okay. Yeah, that's my question.
Okay, so vajacials are the extents of vajacials. Also, I've seen online the extents of vajacials. So I didn't just necessarily mean shaving, but pubic hair is protective from infections. It really is. So we always say when you're shaving, when you're removing pubic hair, ensure you're doing it in a clean or sterile way. And then if you leave just a bit of pubic hair, that is fine. Then what I meant by vajacials is there are places that are offering services where it's not just removal of pubic hair, but steaming as well, and other services in that area, in the vagina. So the steaming, inserting of pearls or other things into the vagina, that can disrupt the normal vaginal environment.
Okay, thank you.
Thanks. Someone has asked a question, but I think it was answered. How about oral sex? Could this also be the cause of STIs, or could it also cause STIs? So yes, so like I said, STIs can be transmitted through oral sex, anal, or vaginal sex. So we've heard about herpes. We've seen signs of oral herpes where a patient comes and they have the sores that could occur vaginally are the same sores that can be seen on the tongue, on the lips, on the inner side of the mouth. So yes, the oral sex could transmit infections such as herpes. Yes. And then someone has asked, okay, someone has asked natural oils like coconut oil in your vagina. Yeah, so again, the vagina cleans itself. It's always a discussion between gynecologists or other doctors and patients as regards using other products to clean the vagina, but the vagina cleans itself. So you do not need to use any oils or soaps in your genital area. A process someone has asked is there a process to follow when shaving pubic hair, because sometimes you feel itchy. So with time, you'll get to know your body. One, I always say know your body. And then two, ensure that the hair removal process is as hygienic as possible. So in terms of the products you use, in terms of whether you're just using a clipper or scissors to clip, or if you're shaving very gently, just remember it's a very sensitive area. So ensure that when you're cleaning, whatever you're using is something that you have stored in a place where to ensure that you don't get infections, you don't transmit skin infections also to yourself. Someone has asked, can lubricants also cause STIs? Mary, do you mean lubricants during sex, like vaginal lubricants? So if that's what you mean, so there are safe lubricants that can be used during sex. And we, again, have this discussion with our patients where lubricants such as KYL jelly are safe to use during sex. There are other lubricants in the market that are safe. However, there are also others that sort of erode or change your normal vaginal environment. Yes, I hope that answered your question, Mary. Okay, someone has asked about lactacid and external cleaning of the female genitalia. So so there are products that can be used, such as lactacid, V-wash. So these are vulval washes that can be used to help restore, particularly for patients who have recurrent vaginal infections. So because sometimes, like I said, some of the vaginal infections are hormonal related. So at a certain point of her menstrual cycle. So for patients like this, we can advise that you use vulval washes. And again, there are some in the market that are not recommended. So it's not advised that you go and buy an over-the-counter medication before you consult with your gynecologist. Okay, someone has asked, what about masturbation? Can it cause STIs? Okay, so STIs are sexually transmitted from one partner to another. So if you're not, if you've never been sexually active, then you are unlikely, if you've never been sexually active, then you don't have an STI to start with. Meaning sexually active, you've never had genital skin-to-skin contact with anyone, and like we discussed earlier, then you do not have an STI to start with. So then if you get infections or a discharge afterwards, that possibly could be something else. Yeah, so it would be important to have your gynecologist examine you particularly, and then come up with a diagnosis and treatment. So no, unless you've been sexually active with someone else before. So that would be the cause. Katile? Okay. Do we have another? Oh, I think I missed one. I think I missed one question before Katile comes on. Somewhere at the top, someone mentioned boric acid. Okay, there's another question as well. Okay. Okay, someone mentioned boric acid as well. Yeah, so recent studies have shown that boric acid can restore one's vaginal pH, so one's normal vaginal environment, and then as a result, prevent recurrent, what we call bacterial vaginosis. And then as a result, because bacterial vaginosis increases one's risk of acquiring, it's not particularly an STI, but it increases one's risk of acquiring STIs, like HIV. So yes, there is a role for that in terms of restoring the normal pH of the vagina. And someone has also asked, does hygiene also lead to contracting an STI? I think it means, does poor hygiene also lead to contract? So generally, like we said, ensuring vaginal health or carrying out proper vaginal practices. So things like inserting pearls or other substances into your vagina are unhealthy practices. So yes, those do affect your vaginal health. And then as a result, predispose you or increase your chances of contracting an STI. So if that answers your question.
I have a question.
Yes, Teresa.
Who are at more risk of contracting STIs between the male and the female gender?
Okay. So generally women are at an increased risk of contracting STIs. And then also as regards the effects, the long-term effects tend to be more on the women and a little more, more severe to the women. Like we discussed, chronic pelvic pain and PID and infertility. So generally the women.
I have something to add on top. Maybe women are more risk than men because just everything goes to them. They're the ones. There's more risk.
So, hi Alice, sorry, say that again.
Okay, I was saying I have like maybe a point on.
Yes.
So for me, I generally think that women are at a higher risk of the contracting the STI.
Yes.
And even the effects too are more on women than the men.
The what too? There's something I didn't hear.
The effects.
Yes, the effects. Yes, you're right. Yes, so women are at an increased risk, and the effects, both short-term and long-term, and even psychological effects, are more to the women. Thanks for that, Alice.
Okay, last question.
No.
A clarification on HPV immunization. Does it start from 13 years or 9 years of age?
So we vaccinate from 9 years of age to 13 years. That's usually our target group because it offers maximal benefit. So generally we are targeting people who've not been sexually active, so therefore not been exposed to HPV. However, we do vaccinate age groups above that. It's not recommended above 26 years, it's not recommended. But like I said, if you discuss with your gynecologist, they do a Pap smear plus HPV if you're above 30, then you can discuss, depending on your risk, you can the risk to acquiring HPV and cervical cancer, you can discuss additional vaccination, you can discuss HPV vaccination, because it's generally thought that even if you have been exposed to HPV, you are unlikely to have been exposed to all the types of HPV. So then you may still have a benefit from vaccination. And some studies have shown that, yes, it indeed does reduce the risk of cervical cancer and warts to a less extent, but still offers some benefit.
Okay, thank you.
Thanks. There's one, oh, just seen there's one question from one boy. Thank you. Boy child vaccination for HPV. Yes, so HPV vaccination is offered to both boys and girls. Yes. The target age group around age 9 to 13. Let's see if there's another question. Someone has asked about hepatitis B. Yeah, so we had mentioned hepatitis B as one of the STIs that we screen for. And generally symptoms can be similar to those of other hepatitis infections, can be similar as in terms of fatigue, loss of appetite, nausea, vomiting, abdominal pain generally, or changes in our urine color, or changes in, basically changes in the skin, because with hepatitis B, sometimes we get yellowness of the skin or yellowness of the eyes, what we call jaundice. It's important particularly to screen in pregnancy. Like I had mentioned, the risk of vertical transmission and the effect to the baby. So it's important to screen regularly and then also in pregnancy. So then now when diagnosis of hepatitis B is made, then now we move to the next step, which is determining, because it's a virus, determining the viral load. And then depending on the viral load and other tests that we carry out, then now we plan treatment for hepatitis B and put the patient on certain antivirals. Okay, if we have no questions, I'd like to say thank you. Thank you for listening in. Yeah, so take home message, I would say screening is very important, and opening up the discussion. So discussions like this, and then most importantly, a discussion with your gynecologist or your doctor or your healthcare worker is very important. Yes, so screening. All right, thank you for listening, guys. I will hand over now to Katila and team to take over.
Question.
Yes, Yvonne, I didn't hear you, the network.
I'm seeing there is another question in the chat box.
Okay. Oh, sorry, I've just seen it. Can washing of the vagina be harmful? Yes, so like I said, intravaginal practices can be harmful. Like I had said earlier, so we had said the vagina is self-cleansing. So it cleanses itself, it cleans itself. Yes, so all you need when you're showering is just to wash externally with water, and that's it. The vagina cleans itself. Between the lips, just wash with water. So no soap, no lotions, no perfumes, no deodorant or other lubricants that are not prescribed by a gynecologist, because those can erode the normal flora, because we have normal bacteria in our vagina and in other areas of our body. So practices such as those harmful intravaginal practices can erode the normal vaginal flora and put you at an increased risk of getting vaginal infections such as candidiasis, which is also called yeast, and candidiasis, which is also called yeast, and bacterial vaginosis. And then, like we said, these increase one's risk of acquiring an STI. There's another question. Okay, someone has said that shida ni venye tu hizi screening huogopesha alafu zinakaa sana kabla zikuje mtaani unless you have cash uzipeleke hosi kuona gani. It's true. It's true. This is true. STI screening, healthcare generally in this country is expensive. That's true. That's one. So as a result, I know, and I think I mentioned this at the beginning of the presentation, that sometimes as part of our guidelines and Kenyan guidelines, we allow for syndromic management. So this is management based on symptoms without sometimes pinpointing an exact cause or an exact diagnosis. So in the public healthcare facilities, if you have a vaginal discharge, still go see your healthcare worker, and then they will prescribe medication to cover for the commonest causes of the vaginal discharge. If you have a genital sore, again, they will give you medication that covers for most of the causes of vaginal sores. So yes, screening and treatment, screening and diagnosis, or rather the investigations, are expensive. That is true. So that necessitates basically having discussions like this, and even at a higher level, to see how to make STI screening as accessible as possible and as affordable as possible. Okay, someone has asked the second question, I feel like I have answered it. As regards the accessibility, it was related to the question above. And someone has asked which vaginal discharge is abnormal and which one is normal. So I'd said earlier also, I mentioned that know yourself, know your body, know your discharge. So that comes with time, yes, granted. So any discharge, one that has a foul smell, you would know, you would tell, because you'd know what is normal for you, for your body. And then when you note a smell that feels foul to you, that has an off smell, then go see your doctor. Then in terms of color, just like I said, with time, you'll know your body. Some people, there is normal cervical mucus. During certain times of your menstrual cycle, you can have a normal discharge. So if you see something that is off, again, in terms of color, something that is greenish or deep yellow or white, then again, go and see your healthcare worker. So number one, know your body, so that when you know your body, then you know what the abnormal is, what abnormal is. Jariah has asked, someone has asked, sometimes we're being treated clinically, then no test, no screening, but you're just being given, tablets. I think she meant to say tablets, and you're told to go home. But when you ask for maybe why you can't do a screening so that we can know where the problem is, the doctor can ask you, where we need actually. Okay. Yeah, that's okay. Yeah. Okay, so I think what she's asking is sometimes you're seen at a healthcare facility, no tests or screening is done, you're given medication, told to go home. And her question is that sometimes it's not that the screening services are not available, but sometimes it's just you're told you're not offered those options. So yes, that is generally a very big problem, particularly in how you put it, because you said that the healthcare worker tells you to just go home and ask you whether you're the one who's a doctor. So one, that is, that's very unfair. I try to be as open and as honest with my patients, and it ends up, I try to make it a conversation. So being told by your doctor not to ask questions is one, very unfair and unethical in my point of view. And so that's why it's important. I would have a discussion with the patient. If the STI investigations that I'm offering are affordable and are accessible, then I would offer them that, and then discuss also partner treatment and discuss screening going forward. And then if in discussion with the patient, we agree on, if the patient is unable, let's say, to do certain tests, and then we discuss what I said, syndromic management, where we manage the patient based on the symptoms she has presented with, then we go that route. But it's always a discussion and not a one-sided conversation. Then someone has said, I think one of the objectives on in reproductive health, I think she means, is that there should be more facilities to offer screening. That is true. Counseling, that is true, because like we said, it goes hand in hand. Okay, someone has asked something. Yes, so like we said, it goes hand in hand, screening and counseling, and then even treatment at everyone's affordable cost that is fair to each and everyone. Yes, thanks for that comment. Someone has said that having to see a gynecologist is costly, so many people prefer to suffer in silence. And that I totally understand. That I totally understand. And so the key thing would be to increase accessibility of the services at every level, and carry out trainings so that it's not just the gynecologist who is screening and testing and treating an STI. No, every cadre of a healthcare worker. So the nurses should be able to do it. And we should carry out regular trainings at all healthcare facilities so that these services are affordable and available to everyone and to the youth. Okay, someone has asked whether we have an attendance form. I think Katile will answer that. Another comment. It's like we don't know, someone has commented and said it's like we don't know our rights as clients because sometimes doctors don't have time for us. Now that makes me sad. That makes me sad. Yeah, that makes me sad. And that is true. I have seen cases where there really is no excuse for it, but patients are seen hurriedly. I have seen instances where we as doctors or even generally healthcare workers see patients hurriedly, and that's not fair. Yeah, so I hear your comment. Another comment is there should be much more counseling. Like you said, majorly is to counsel because most people are afraid. Yes, thanks for that comment. Like we said, counseling is important, and counseling helps get rid of the stigma. The stigma surrounding STIs is huge. It's a huge problem. It's associated with a lot of shame, particularly in couple situations. There's a lot of blaming, usually going back and forth over who brought the STI. So whenever I see couples, first of all, I try and tell them to not focus on questioning whether it's me who brought the STI or whether it's you who brought the STI, because that most times doesn't help. So usually I focus on counseling as, let's deal with the issue at hand. Let's deal with what we can do to manage the issue at hand. And then, like we said, link the patient or the couple to a counselor. And that's very important. Okay, so I'd like to say thank you and hand over to Katile if there are no other questions. Thank you.
Hello. Hello, everyone.
Hello.
I think before Katila comes on, we appreciate our speaker so much for the wonderful session. Personally, I learned a lot, and I hope everyone also. And we wish that she can come over again, train us once more. Now I hope we have full information about the STIs and how they are transmitted, and we appreciate so much. Thank you, our speaker. May God bless you.
Thank you so much, Yvonne. Thank you. God bless you too. Thank you everyone for listening. And yes, I really am looking forward to having more conversations like this and others with the entire team. And I think you can, if anyone has any query that they'd like to ask me personally, Katila and Yvonne have my numbers. My number is open to anyone who wants to reach out. Have a good evening.
Thank you. Katila, please.
Hi, Yvonne. I think Katila is held up a bit. I think we should just end up the session. We are very happy for the speaker and all the participants. Thank you for coming in. Let us pray and we end up the session. Our loving Father, this evening, we thank you for giving us this time. Thank you for giving us the best speakers who have taken us through the STI topic. And we are happy you have enjoyed the topic and the session. And we are praying you guide us. For all of us who have attended and those who did not attend, we are praying for them to attend the remaining sessions that we have. We're praying this, trusting and believing in the mighty name of Jesus. Amen. Thank you guys, and everybody have a lovely evening.
Thank you. Hello, I think about the attendance list, Katila will share or communicate about it. Yeah, I'll inform her to communicate about it. So we can end our session there. Have a good night, and you can do